Kristen Clinton. I'm a physical therapy student at Campbell University. Today I'm going to be demonstrating the FABER and the FADIR test. Before I demonstrate the test, a little background. The FABER test is a special test that can be done clinically to indicate that your patient has a hip pathology such as osteoarthritis. In a study done in 2014, they found that during the test, if your patient presents with anterior hip pain, that can be indicative of a femoral acetabular impingement or of psoas tendinitis. Lateral hip pain during the test can be indicative of a lateral acetabular labral impingement. And then if your patient reports posterior hip pain, that can possibly indicate sacroiliac involvement. The test I'm going to talk about is the FADIR test. According to an article by Tranovic in 2014, the FADIR test has a high positive predictive value for femoral acetabular impingement. Both tests, the FABER and the FADIR test, have a high sensitivity for identifying femoral acetabular impingement, as well as detecting labrum and flap cartilage lesions that can be associated with a femoral acetabular impingement. So to perform the FABER test, I'm going to have my patient in a supine position. I'm going to put her hip in the position of flexion, abduction, and external rotation. So hip flexion, abduction, and external rotation. And I'm going to have her in what's known as the figure 4 position like this. To perform the test, I'm going to stabilize the opposite ASIS with one hand and have my other hand on the side of her knee. And I'm going to apply a downward force. I'm going to make sure I get a look at my patient's face as well. If the patient reports deep hip pain, that could be indicative of a hip pathology such as osteoarthritis. If they report pain in the sacroiliac region, I would need to examine the SI joint further. To perform the FADIR test, the patient is again in a supine position, and this test is performed passively with hip flexion, adduction, and internal rotation. So I'm going to passively move my patient into those positions. So flexion, adduction, and internal rotation. And if the patient reports pain in the mid-buttock region or symptoms going down into the leg, that is a positive test, and that could be indicative of a hip pathology such as a femoral acetabular impingement. Both tests, the FABER and the FADIR test, can be used in the clinic to identify a hip pathology in your patients that are experiencing hip pain.